the healthcare space is, there's obviously a massive amount of regulation, but in healthcare, the data is remarkably well organized. So when we think about, being able to do sorts of, condition-based targeting or some sort of like organization of machine learning-based solutions for ad delivery, the data actually exists today in a very well organized schema. And what I mean by that is, we can get to the data that we need. And the real challenge there is HIPAA, right? And privacy constraints. So, we've developed and invested a lot of technology and time into building out HIPAA compliant solutions for ad serving. So when we reach, patients, when we have a brand new solution that it's called patient modeled audiences, it's been well received. The targeting has been, phenomenal. Audience quality is as measured by third parties has been really spot on, if not, we're 80% of the time the best performer on a media plan. So we've done a lot really to push the ball forward in the healthcare advertising space and deliver the right information to patients. And that, we've built in, one of the things I've done as CEO is build out a really strong, robust team that's well versed in the programmatic ecosystem, as well as healthcare. And combining those two together, it's not easy. These are very different domains, but pulling that all together into one company, Deep Intent's really found a great niche to be the leader in. Deep Intent has built our own DSP. So today that means that we can access any programmatically available media. So programmatic is a tool that we use to connect our clients with the users and the patients and the healthcare providers that they need to reach. So when we think about that as a tool, right, we're actually screen agnostic. So the new advent of CTV, right, and other sorts of new formats, it's easy to roll into our DSP platform. So today we have clients that work with us either on a managed service, basis, where we will actually run the campaigns for them, or we also have clients that prefer to be hands-on keyboard using our DSP on a self-service basis to reach those audiences that they need.
Tell us about audience targeting, and you referenced, obviously HIPAA is a big issue in
Mm-hmm.
privacy.
Yep.
Tell us how you work with data vendors like Epsilon and others to allow you to, target according to condition and other factors that you come into your targeting. How does that work?
Mhm. Yeah, so it's obviously a very important space for us, and a very important issue. HIPAA is ubiquitous in the healthcare data space, and we take extraordinary measures to make sure that we're being HIPAA compliant. So when we actually receive a targeted condition from our clients, we actually don't touch, or we actually don't work with any healthcare data directly. What we've built is it's a patent pending solution that allows us to stitch together disparate healthcare and marketing data sets and use AI to actually do the modeling, and actually create these targeting segments based on the conditions that our clients are looking to reach. There's a lot of content available on this online, which I'm happy to share. But long story short, it's a privacy safe way for us to be able to do condition-based targeting across any screen or device in the US.
So, what are the opportunities for marketers to have ROI performance? How do you prove it, and how does your system, create value for
Mhm.
marketers?
Yeah, so we've invested heavily into building kind of three key types of platforms, right? We have our planning tool, we have an activation platform, which is our DSP, and then I'm happy to share that we're going to be announcing our measurement platform at the end of this quarter. So measurement really is a capstone of those three kind of main solutions, pulling together the planning and activation components within the ability to actually tie back the actual clinical outcomes to the campaign data that we have. So when you as a marketer run a campaign with us, you'll be able to see for both patient campaigns and providers the actual efficacy and the ROI on your campaigns as it's counted in number of scripts being written or number of positive outcomes in patients. We have that ability to be very flexible. And so by having that capability embedded within our platform, it's going to be like no other platform that's out there, improving the time, the transparency, and the performance of your campaigns.
And finally, I want to talk about CTV. I know it's a very hot sector. Obviously, healthcare is a massive advertiser, of course, in television. What is the opportunity for marketers to you know to play in the CTV space? What are you guys doing? And what is the role of CTV for healthcare? Is it sort of just buying reach? How do you see it shaping up?
Yeah, I think COVID showed us that streaming and AVOD is a massively developing format, right? There's a lot of people that are starting to turn to, cord cutting, and now embracing, apps like Hulu and other streaming devices. So when COVID hit, we saw the opportunity to really double down and start to offer our CTV marketplace, which allows us to do the same level of targeting and measurement that we would on all the other digital channels we plug into, but for connected TV. So we're going to be the first platform that allows for multi-screen advanced advertising, basically cross-channel, omni-channel marketing across for both patients and providers. That includes the measurement capability to say that this dollar invested into CTV actually yielded $10 on the back end in terms of ROI. So that having this all integrated within one platform allows us to have more control over the data, especially now when we're thinking about privacy and regulations, and specifically, in California CCPA and CPRA, and that gives us more control over how we're using the data, ensuring that it's privacy first, and then for healthcare, that obviously is a very big selling point.
And Chris, tell us a little about the roadmap. What's next for you guys? What we can expect over the next 12 months.
You're going to see some really exciting things coming down the pipe as it pertains to actually measuring and evaluating the campaign performance on an outcome basis. In healthcare, traditionally today, it's in programmatic, it's a system of point solutions. So we have your DSP and a data vendor for targeting, and then a data vendor for measurement. By rolling these all together for the reasons I just mentioned, we're really going to have three big value propositions. We're going to have quicker speed to understand what's working on your media plan and what's not. You're going to have stronger performance because you can take those insights and then actually optimize out in real time granularity measures such as publishers or creatives or frequency. And then ultimately the transparency that we're bringing. Because we deal with healthcare data, we're 100% transparent with how we're actually using the data. And we have certifications. We've done rigorous third-party validation and authentication on the way that we actually use the healthcare data. So it's a very important area. And by combining these three kind of key value propositions within a DSP, we know that our clients are going to have the best performance that they've ever had on their campaigns. Deep Intent has grown 3x year over year for the past 4 years. It's been a phenomenal rocket ship of a ride, to be honest. And honestly, COVID was a big boost for us as well. I mean, obviously, was a challenging time for most companies, but the need for healthcare marketing was so present and so ever kind of needed, right? For the crew that we have, we've taken this opportunity to work in the healthcare space and marketing space. So we need to have competency across the board. We have really strong agency strategists at the C levels of our companies. We also have really strong programmatic specialists at the C level of our companies. So by combining the healthcare kind of data competencies with the programmatic data competencies, we have the right team that's set to deliver these types of solutions that we're ambitiously trying to deliver on. With that all said, our team has been growing. We're now at 90 people. That's up from 40 at the end of last year, and plans to get to over 100 by the end of the year.